heart cannot pump effectively, and we will immediately develop hypoxia, and the tissues will suffer from death. And this happens when there is a problem in some parts of the body. You must have heard in the hospitals, in our families also, we have people who develop shalal. Okay? Shalal is paralysis. Okay? Somehow, one artery of the brain or one vessel of the brain, it has an obstruction. And this obstruction is due to the clotting of the blood. The blood changes and it becomes solid in that area. Okay? Or some solid part, the broken part of that solid goes and it settles down in the artery of the brain, and all of a sudden the blood supply to that area that is compromised, that is decreased, suffers from ischemia, and there is moth of that part of the brain, death of that part of the brain. Okay? That is ischemia. Infarction develops. Okay? But normally, throughout the lives of most persons, alhamdulillah, nothing happens. This is the quality of the blood. It means blood, even though it is very unique, it also has some special properties which prevents it from changing the state. And it does not become jelly, it does not become solid, it does not change the state, it remains same, healthy and circulating. That's the whole idea. But we all know that, we have seen that once our blood comes out, one drop of the blood or large amount of the blood, or it comes over the surface, we are playing and we fall and we have an injury, some blood comes out, we know that, okay? So it's common. And if you don't clean it, after some time you will see it becomes like a jelly, isn't it? It clots, it changes the state. Once it is out of the body, it changes the state. Even inside the body, if the blood comes out of the blood vessel, any blood vessel is broken, which happens, which can happen. Some blood, yeah. Any cut, any other thing, any internal injury and the blood vessel is broken, you can't do anything. Some blood will come out. That blood will not remain the same blood. After 10 minutes or 12 minutes, that blood becomes like a jelly. Okay? It changes the state to a semi-solid thing. And clotting also occurs inside the body. But normally inside the blood vessels, normally inside the circulation, do you think clotting is a normal phenomenon? No. There should be no clotting inside. Only at those points, if there is a little injury, at that point, first of all, micro injuries. I am talking about little injuries, micro injuries. Micro injuries happen daily. Okay? For example, we are sitting, we are standing, all of a sudden I am talking to you and I sit here like this. Okay? And then I stand up like this. I have got hundreds and thousands of capillaries which are very thin. Some of the capillaries may have a little break, and a little amount of blood tries to come out from that break of the capillary. Okay? But at that point, the break is so minor that you don't need clotting there. What do you need there? You don't need clotting. You want to close that gap, very little gap in the capillary. Imagine, capillary is such a small vessel, and if it's slightly broken, a little microfluid may come out. But before that, something happens. And there is one special thing mawjood in the blood. Platelets, thank you very much. Platelets will form the plug. They will have an isthema. They will have a group, and they will try to stick to that area and close that area. And that's called the platelet plug formation. Okay? So the platelets have the property of forming the plug. But this is not coagulation. This is not clotting. Okay? So it is only just having the platelet plug. You are filling and you are closing, you are sealing the gap. And that happens all the time. We don't know it is happening. We are sleeping, we are awake, we are running, we are playing, we are sitting, we are standing, we are doing so many things all the time. Well, these phenomena are going on. It is natural. And that prevents any loss of blood from our blood vessels. Okay? But at times we need this phenomenon clotting also. Clotting is essential. Clotting is a part of hemostasis, and hemostasis is a part of homeostasis. I think all of you know the meaning of homeostasis.
Yes.
To maintain normal health of the body, normal environment inside the body. That's homeostasis. And if I use the word hemostasis, what does it mean? To stop the bleeding, okay, prevention of the blood loss, right? That is hemostasis. So, what do you think? If I say platelet blood formation, is it a part of hemostasis? Yes or no? Yes. Definitely, it's a part of hemostasis. If I say that the blood vessels are undergoing spasm, spasm means the shannuj. You are saying it's like the smooth muscles are contracting, okay? And they are trying to decrease the putter of the blood vessel. So is it a part of hemostasis also? Yes. When there is some injury? Yes. Why not? It is also a part of the hemostasis. But this coagulation, okay? If I say one is ibtidai hemostasis and one is thanawi, the second type or the secondary one, the primary and the secondary. So which one will be the primary? The blood formation should be the primary one, right? And if on that plug you are building up something else and you are making a clot there, then it will become secondary hemostasis. So what we are dealing with now is a secondary hemostasis, and that's pretty complicated. It's not so easy. It is having a complete mechanisms. Until now, we have not completely understood all the mechanisms. It is complicated in the form of pathways and everything, but it's very important and it's very essential to know. Okay? So we are dealing with a phenomenon of coagulation, and I have given you just an idea about the coagulation. This is what we are going to discuss here as an objectives of our lecture. If you can see, we'll talk about the whole mechanism of coagulation, and we have a focus on some special factors which are modules in the blood. These factors are usually proteins modules in the blood, okay? Plasma proteins like this. And they have a special role in the clotting process. I'm using two terms. Are you comfortable? Sometimes I'm saying clotting, sometimes I'm saying coagulation. I'm using two words. So what do you think? Are these two words same or different or what? Same. It's same. Two names for the same thing. Clotting is a common English word, everybody can understand. But once you are becoming a doctor, when you are doing medicine, you are a medical student, the medical term for clotting is coagulation. Okay? Coagulation or clotting is a mechanism or a process. In this process, the normal blood, which is liquid, changes into a semi-solid jelly-like mass. Okay? You see yourself that it becomes sticky and jelly-like. Okay? And if you leave it and let it dry, then it will become hard, like a scab also. But what happens? The normal blood changes into the jelly-like thing, and that jelly-like thing is trying to close the wound or the injury in that region. Okay? And this phenomenon is simply known as coagulation. The other word is clotting, as we are discussing. Okay? So when I am using the word clotting, the process is called clotting, but the thing which is jelly-like thing which is formed, what do you call that thing as? Clot. So clotting is the phenomenon or the process, and the result which is formed, that is called clot. Now, in the same way, now I take coagulation, the same thing, coagulation. So the process is coagulation. Okay? But as a result of coagulation, what is formed? What is the other name of the clot? Now you take it from coagulation. From clotting, you are calling it clot. Right? From coagulation, you will call it what? Use a term. Try to make a term from that. Come on. Same thing, yani. Clotting, clot. Sir? Coagulation? Coagulum. Coagulum. Very good. Okay? Very good try. Coagulum. So the other name of the clot is coagulum. Okay? So especially for us, for medical students, our term is coagulum. Because coagulation is the correct medical term that we are going to study. Now, do you understand the difference between the clotting and clot and coagulation and coagulum? Is that clear? Okay. the blood in hands for some time, it will try to become thick, like jelly, or it becomes apparently like thick like the pieces of fresh kibda, isn't it? It's very bloody and very having same consistency like that. So blood changes its state, and that is the clot. Okay. Now two terms. You said thrombosis. You are using the word thrombosis. Okay. That you have studied this phenomenon thrombosis also. And in thrombosis also the same thing happens, isn't it? Yani, you say it's also clotting process. Okay. What is the fuss between normal clotting and thrombosis? Yes, thrombosis is something which we don't call it normal or in a healthy state. Okay? The term thrombosis is mahsus, it's a special term, and khususan you are using it when there is some pathology going on inside the body and the blood clots inside the blood vessels. As you are saying, very nice explanation, that inside the blood vessels. Because normally we talked about that. Blood never clots inside the blood vessel. Normally. It should not. It must not. But if it clots due to some reason, then that clot which is formed in some area, that is called thrombus. What do you call it? Thrombus. Thrombus is a clot, but it's a pathological clot. That's okay. Okay? Physiological clot is normally what we have. If we have any injury, we can have clotting. Sometimes you are playing Kuratul Qadam and obviously you have a fall. And you see, oh, there is no external injury, there is no cut, there is no wound here, but that area gets a little swollen and the color changes, it becomes blue. There is a bruising or a blue coloration. What has happened? That some blood has leaked inside, under the skin. It is module outside the blood vessel, under the skin. That blood also clots. Okay? Now it is module below the skin or beneath the skin. Some blood and the color changes, isn't it? That blue color. And then after a few days you see that blue color becomes bluish green in color, and then slowly after 1 week it becomes yellowish green in color, and slowly the color changes happens because that blood is disintegrated, that is destroyed by the tissue enzymes and it is degraded. Okay, but the clotting also happens in that condition also. Okay? Normally when we have injury, we have this blood coming out, some blood goes in the tissues, some blood comes over the jild, and it clots also. You know that. We all have this experience. So, physiological versus pathological means in healthy states you have, and you are using the word clotting, but when there is an abnormality which is happening inside the body, some disease, and there is intravascular clotting, pathologically, call it thrombosis. Okay? Any questions about so far? Everything clear?
Yes.
Are you catching my speed also? I am going a little quick. Is it okay?
Yes.
Alright. So, the normal blood, alhamdulillah, has a unique property that it has some substances which is making the blood anti-thrombogenic. Normally thrombosis will not happen. Normally inside the circulation, the blood automatically, naturally will never clot. Because blood has some protective mechanisms which protects the blood from getting clotted inside the blood vessels. In all of us, alhamdulillah. This is the gift of Allah subhanahu wa ta'ala, that we have to live like this. But this anti-thrombogenic balance, there is a tawazun in which blood has both things. It has the clotting substances and it has anti-clotting substances, both modules in the blood. Now, right now, normally our blood is moving and moving and moving. So there has to be a balance between clotting and anti-clotting substances. Which one should be a little more? Yes, a little more. So that, alhamdulillah, it's a protection. Okay? So there is a balance shifted more towards anti-thrombogenic components or some anti-clotting substances. They are a little more, and this is protection. But if in any region of the body, when the blood is flowing or going in one area, if the clotting substances become more than the anti-clotting substances, what will happen then? Then, yeah, if they become more clotting in one area, so there is a chance of thrombosis or clotting in that area. Okay, so this balance is very, very important, and this protection is modular in all of us. So clotting only happens when this balance is shifted to this side. Yani thrombogenic substances will become more and they will become more active, and that area will start the clotting. It happens. Okay? Right. Now, what do we have? Where is the story going on when we are discussing clotting or coagulation? What is happening? We have to consider the blood vessel, because blood is modular in the blood vessel. And blood is touching, all the time touching the wall of the blood vessel. Isn't it? This is the first thing. Second thing is a very important cell which is present, or very important components of the cell called platelets, which are modular in the blood all the time. Alhamdulillah, we have got a very high level of platelets, 150,000 to 450,000 per cubic millimeter or millimeter cube modular in the blood. Okay? So kathir number of platelets modular normally. Okay? And they are very helpful. They are releasing many chemical substances. They are helpers. They are looking at any place where there is a slight, you call it tahreek, right? There is a leakage, isn't it? Yes. They go and they just stick it, okay? And they form a group and they attach and they try to close it, okay? Before clotting, platelets are working. They are the best workers really. And then, if the platelets cannot control the situation, yani the gap is bigger and you need more strong closing, then what you will have? You will have the coagulation or you will have the clotting. Okay? So these three elements are very, very important in the clotting, and they are playing, because the clot will try to close the wall of the blood vessel. When there is injury to the blood vessel wall, things will change. The blood can come outside. There is a problem. And then the coagulation or the clotting mechanism has to start in that case or in those circumstances. Now, let's have a look. Next slide. What is the next slide telling us? We are just talking about the blood vessel wall under normal conditions and when some injury is modular there in the vessel. Okay? So, normal vessel wall, alhamdulillah, has a protection, because blood is modular all the time touching the wall throughout. 24/7, all the time, throughout our lives, it's happening, okay? So, you are just imagining that how can the blood protect itself from getting clotted, really? Well, it means it's a beauty of the blood vessel wall. You know, blood vessel wall is, for example, this room, for example, this is a blood vessel, for example, okay? And blood is modular here. And this is the wall of the blood vessel. Now, this wall will have a very special characteristic. It has the endothelial lining, you know that. Okay? And on the endothelial lining, cells are modular. These cells have a little glycoprotein layer called glycocalyx modular. And that glycocalyx has special negative charges over the surface. Negative charges are modular all over the surface of that. First of all, it is very slippery. Yeah, you can see the tiles here. These tiles are very slippery, very smooth, isn't it? Okay? Just like that, endothelial cells are very smooth and very slippery. Then you also have a little glycocalyx module, and that glycocalyx carries the negative charges. Imagine negative charges. Now you see the blood cells, the platelets, the RBCs, the WBCs, the plasma proteins. All of them on their surface also have negative charge, as you are seeing, right? Now, negative comes close to negative. What will happen? Repel. Okay? You cannot bring negative to negative. They are not attracted. So the cells have the negative charges, alhamdulillah, over their surface. Plasma proteins have the negative charges over their surface. And endothelium, yani glycocalyx, also has the negative charges. So it means the platelets cannot easily come close normally. They cannot make a group and they cannot start ijtima over there. No, it's not mumkin. When there is an injury, then there is a problem. But normal blood vessel wall is a perfect wall which is allowing the blood to slip, to move without any problem and without any clotting or without any obstruction. Okay, that is the beauty of the endothelium. So Alhamdulillah, our endothelium is a great help. Okay, so that's the first second. Normal blood vessels, nothing happens. Okay? But when there is a damage, then for example, this tile, okay, this is one endothelial cell here module. Okay, now I bring a hammer and I break one tile and I remove this tile and throw it away. Yes, the ground which is present beneath the tile. Do you think it is very smooth like a tile? No. It's rough cement, isn't it? So collagen fibers are module over there. Now when the blood comes in contact with that collagen, the problem starts. And now the platelets will stick easily, and now the clot can form in that area. Here. No, it will not form. Okay? Because of the negativity, because of the slipperiness, because of the smoothness of the endothelium, nothing will happen. But once one cell is broken or some cells are broken, the problem will start. The cells will release some substances, number one, and number two, below the cell, collagen is module, subendothelial collagen is module, and that is the problem. Now the clotting can initiate or start. And this is the cause of normal clotting also, and this is the cause of thrombosis also, which happens inside. You know, thrombosis which is abnormal. The endothelium becomes rough in one region. The endothelium loses the negative charge. The endothelium is damaged, and in that area you will start the thrombosis process. Okay? So normally nothing is happening, as you can see in the picture also. But once this area, 1, 2, 3 cells are broken, you can see. Now the blood cells will be attracted. Platelets will come closer, RBCs will come closer, WBCs will come closer, and they will entangle and they will stick and attach, and the clot formation will eventually happen. Okay? Are you clear about this slide or diagram? Any problem? All clear? Okay. Now, the coagulation. What is the falsafa of coagulation? What is the basic idea? What is the basic thought behind coagulation? Yani, what is happening in coagulation? That's the whole idea we have to generate. Okay? Well, coagulation is not a single step process. It's like you have seen a waterfall. Okay? What do you call waterfall in Arabic? I forgot. Shalal. Okay, Shalal Bagh is there always, I see, yeah, and I forgot the name. Shalal. So it's cascade. You have seen the waterfall that one fall is there falling on the rock, and then there is a second, and then there is a third. So it's stepwise. 1, 2, 3, 4, 5. It looks beautiful, really, isn't it? Yes. Just like that, in coagulation also, there is one step which is going into the second step is going into the third step. Yani, every step is initiating the next step or reinforcing the next step. So this is called cascade. A tertib of reactions is there actually. Okay? So it's basically a cascade in which, in this cascade, what happens? One protein or one inactive enzyme is modules in the blood, or which is coming out of the cell. That is converted into the active enzyme, and the active enzyme and the other one will form a complex, and this new complex which is formed, it will activate the next inactive one. The next inactive will become active, it will activate the next one. So with tertib, one after another, one substance is formed, that will activate the next substance, and tuck, like a dominoes. You are playing the effect. It's just like that. You got the point? Okay. So in coagulation, there are many steps, and we have to follow these steps. And at the end of the step, final substance is formed, and that will result in coagulation. Okay? So let's see what's happening. It is the definition of the coagulation cascade. What is the meaning of the coagulation cascade? Okay, you can see it's a set of reaction, or it's a sequence of reaction in which blood is changed from the normal liquid state into a jelly-like state, and then the clot is formed. And that clot is formed not separately, but it is formed within the platelet plug. Yani owl, the platelet plug is maujood, and filling that platelet plug, you are making it strong, you are making it reinforced, you are making it powerful in the form of a clot. So imagine everything is happening around the platelets. Okay? The RBCs will come, WBCs will come, the plasma proteins will come, and they will form kind of a jelly-like substance, and that will close the wound or the area. Okay, now Shabab, before understanding the cascade or the tartib of steps that we are going to discuss, we need to understand the background, that what substances are used in the process of coagulation. Okay? These substances are maujood mainly in the blood. Okay? Should they be active or inactive normally? Inactive. Oh yes, the concept is that they should be inactive. When you need them, then they will be activated, and then the clotting will happen. So these substances, most of them are maujood in the blood in the form of proteins, plasma proteins. Okay? Some of the substances from this list, they are also maujood in the endothelial cells. They are maujood inside the endothelial cells. And some of the substances, okay, which are here, they are maujood in outside the blood vessel. It means not in the endothelium, not in the blood, but barra, outside the blood vessel, in the tissue. In a tissue just outside the blood vessel. Okay? Now let's see. Look at that chart and try to understand. There are different substances which are used in the clotting. These are many proteins or protein-like substances which are maujood. And this is the other name of these substances. Okay? Other famous name. And this is their source. Mauka, you can say that, where they are maujood, they are residing, they are living, where are they produced from? This is the idea actually. So, let's do one by one. I think everybody of us knows fibrinogen, isn't it? Yes. It's a plasma protein, we have done it before also. Everybody understands fibrinogen? Okay. It's a big size, rather the biggest protein in the blood. Concentration is little, but it's a big size protein. If I compare albumin, globulin and fibrinogen, which one is the largest one? Okay. Definitely fibrinogen is the largest. Okay? It is called factor 1, factor awwal of the clotting. Factor awwal is fibrinogen. Okay? It's produced by the liver. You know, plasma proteins are produced by liver. Taqriban, all plasma proteins are coming from liver. Taqriban, major ones. Prothrombin is another plasma protein which is maujood in the plasma normally. If I take my blood, prothrombin is maujood. Okay? If I take your blood, prothrombin is maujood. In everybody's blood, prothrombin is there. Prothrombin is called factor 2. Okay? The first one was fibrinogen. When I add the word gen, it is inactive. It will be activated and it will not be fibrinogen then. The name will change. It will become fibrin, inshallah. Whenever it happens, it will become fibrin. But right now, normally in the blood, it is maujood as fibrinogen or inactive. Okay? What about prothrombin? What do you see? Pro is maujood. The same thing. Pro also is inactive and it will become thrombin. Okay? Which is very powerful and very active. But later, not now. Okay, we'll see. Prothrombin is also coming from liver, right? The third one, it's called tissue factor. Shabab, when I say tissue factor, it is factor thalib. Okay, the third one. But the name is saying, should it be maujood in the blood or in the blood vessel wall or outside the blood vessel? It should be outside. It's a tissue factor, yani barra, it's maujood outside. So when the tissues are damaged, when the blood vessel is broken, then this factor is released. The tissue factor, the 3, number 3. Okay? Subendothelial, it means it is maujood in subendothelium or outside. Okay? Not in the endothelium, not in the bloodstream, no. Calcium is an ion. Everybody of us knows about calcium. We have done it so many times. We know calcium is used for bones and muscle contraction and for the action potentials and for so many things that is function. But calcium is also there for clotting. We know that, right? Calcium is lazim for clotting also. So calcium is factor number 4. Now, the fourth one is the calcium. Is calcium a protein? No. So if I say out of these factors, give me one factor which is non-protein factor, which one will you choose? The calcium. Okay. Owl is protein. The second one is protein. The tissue factor is not protein, it's a phospholipid. It's a mixture of phospholipid. The third one, tissue factor. But calcium is an ion. You know that. It's non-protein factor. Look at factor number 5, Shabab. Number 5. Factor 5 here is saying that it's a labile factor, isn't it? Anybody knows the meaning of labile? Changeable, or which is not stable, unstable. And if you leave this for some time, it breaks. Okay? It disintegrates. Okay? It changes. Very nice. So it's a labile factor. It's not like strong factor, it will not remain like this. It will change quickly. It will be broken down. It's called the labile factor. It's factor number 5. But this labile factor is released from vascular endothelium. Okay? So is it intravascular or extravascular? What do you say? It's intravascular, isn't it? Alright, alas. Factor number 7. It's called stable factor, just opposite of the labile factor. It's powerful, it's strong, it's stable. Okay? Now, one thing must be bothering here when we are discussing. What is bothering you here?
Factor 6.
Factor 6. Why you are, don't you know mathematics or the numbering? And from factor 1, 2, 3, 4, 5 and you are jumping down to number 7. Where is factor number 6? That's a question, isn't it? Shabbat. When these clotting factors were discovered 100 years before, even more than 100 years before, they were discovered. Okay? At that time, the classification was 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, talatasha. Asali factors, talatasha. Okay? Later, it was discovered that factor number 6, which was named, that was actually not the real factor. There was a confusion about it and it was proven wrong. At that time, they decided now what to do. Should we change the tartib of all the factors? La, just cancel this factor and let the tartib remain same, numbering remain same. Don't change the numbering. Okay? But cancel one factor and factor number 6 was cancelled. Okay? That's why we don't have factor number 6 here. So from factor 5, you are coming down to factor number 7. Imagining that factor 6 is now halas. Okay? It's the fukdan now. It's the loss of this factor. We have lost it, it's gone, we don't care about it. Okay? So factor number 5 and then factor number 7. Are you following me? Okay. Any problems so far? Okay. So factor number 7 is a very powerful factor and that factor is also coming from liver, factor number 7. Okay? Factor number 8 is a very famous factor which you will do again and again because factor number 8 is related with hemophilia. Heard about this? Disease, hemophilia, a bleeding disorder. Inshallah, you will do it. Okay, after some time, tomorrow or day after tomorrow, you will do. So there is a bleeding disease called hemophilia, okay? And this factor is anti-hemophilic factor. Yani it prevents hemophilia. So those persons who are having hemophilia, they don't have this factor. Genetically, they don't have this factor. It is missing from them. Okay? Or it's less or it's not working very well. So that's the problem. So this is called anti-hemophilic factor, factor number 8. And this is also coming from the vascular endothelium. Alright? Factor number 9, a very famous factor called Christmas factor. Okay? Christmas. We say Christmas. Christmas? Why Christmas? Christmas is a celebration for Christians, but why have they put this name of Christmas here? Actually, this is named after one patient who was Mr. Christmas. The name was Christmas for the disease. It is not for the name of the doctor who discovered it. It is on the name of the patient, okay, who had this disease. Genetically, this factor number 9 was not majood in that patient, and his name was Christmas factor. He was the first patient, and that's why this factor is now labeled as Christmas factor. Okay. Anyway, factor number 9. This is coming from liver. It's a protein. Factor number 10. It's called the Stewart factor. It's also coming. It's a protein. It's coming from also liver. Factor number 11. It's called. Look at the name. The name is Tawil. It's called PTA. PTA. Plasma thromboplastin antecedent. Okay. PTA. So factor number 11. This is also coming from the liver. Alright? It's a protein. Factor number 12. Hagman factor. After the name of the scientist who discovered it. Hagman factor. It's Adnasha. 12. Okay? Is it a protein? Yes, it's coming from liver. It's also a protein. Yes. Factor number 13. Number 13. Talatasha. So I told you the asl list of the factors which was made initially. How many factors were there? 13 factors were there till here. Factor 13. After that, we added some minor factors which were also involved in coagulation. It's Jadid addition. But the original list is up to number 13. Okay? Factor number 13 is fibrin stabilizing factor. It's a very important factor because it stabilizes fibrin to make strong clot. Okay? It makes the clot powerful so that the clot cannot be broken easily. This factor is a very important factor. It's 13. Okay? Coming from the liver. So what do you guess about that? Protein or not? Should be a protein, and it is a protein. Plus. Okay? One very interesting factor is called little factor. You will study inshallah in diseases, leading diseases called von Willebrand's factor. VWF. Von Willebrand's factor. This one. VWF. And that's also coming from vascular endothelium. It also comes from platelets. It is also modular in the platelets, but mainly it comes from vascular endothelium. So, again, is it modular in the blood normally? Yes. Von Willebrand's factor. Endothelium. Okay, a little quantity is modular in the blood, you can say that. Okay? But it is actually released when the vessel wall is damaged or the endothelium is damaged. Okay? Alright. Then you have got other factors, prekallikrein, which is called PK, and that is coming from the liver. It's a protein. One is high molecular weight kininogen, and that is HMWK, high molecular weight kininogen, and that comes from the liver. From this list you can see that most of the factors are the protein factors, and most of the factors are coming from the blood vessels. Few, 2 or 3 are coming from endothelium. And Wajid is only there, which is mainly modular outside the endothelium, okay? Outside in the tissues, or maybe in the subendothelial wall, it is modular. But it is not modular in the endothelium or not modular in the blood, and that's tissue factor. Remember that. Tissue factor is the only factor. Alright? Out of these all factors, only part 1 is non-protein factor, and you can see that. Well, not one non-protein factor. I'll say one is an inorganic factor. Inorganic. What is that one? It's calcium. All other are organic factors. Okay? But Wajid is inorganic factor, or Wajid is iron. Is the list clear to you? Because now these names will come in the cascade. So now you know the names, and now we'll see how which factor is activating which factor and which factor is working on the next factor, like this. So once we are done with the list, out of all the factors we have done, factor number 5, factor number 8, tissue factor, and HMWK, high molecular weight kininogen, are 4 factors, okay, from this list. These 4 factors are cofactors. They are the helpers. They are not main enzymes. They are not enzymes, okay. All other factors, after activation, they become enzymes. But these 4 factors, they help the process, but they are not themselves enzymes. Okay? So they are non-enzymatic cofactors which are helping in the conversion, and you will see that. Okay. Now, phases of coagulation. We divide the coagulation for understanding. We divide the coagulation into phase. The phase awal, phase thani, talit, and rabi. 1, 2, 3, 4. So we will discuss, we will understand this coagulation in 4 different phases. Okay, one by one. Okay. Look at that. 4 main phases. Yes, we are done. Just name those phases first of all. The first one, okay, will explain you about the 2 pathways, okay, in which many reactions are happening. 2 pathways are here. Okay. One pathway is dakhili and one is khariji. Okay, intrinsic and extrinsic. Okay. When I say dakhili or when I say internal or when I say intrinsic, I mean this pathway operates only inside the blood vessels. When the blood vessels are totally closed and when the blood vessels are not having any injury from outside, this pathway can be initiated, can work in the closed blood vessel. Normally, in a closed blood vessel, if clotting pathway is working, is it normal thing? No. So if it is working, what will it lead to? Thrombosis. So it means if I ask another question from this way, and I say, which pathway is actually responsible for thrombosis? So you will say intrinsic pathway, right? You will not say extrinsic pathway. You will only say intrinsic pathway is mojood and working for this one. Okay? So, fine. Both the pathways, okay, they are separate pathways, intrinsic and extrinsic. Okay, they have different reactions. But finally, these 2 pathways are coming together at one point. They meet at one point. After that, common pathways form. So one pathway is extrinsic pathway, one pathway is intrinsic pathway. When they meet at one point, after that there are few steps, but then you will call them common pathway. Okay? You got my point? Yes. Alright. So from this point, from factor 10, when we come to factor 10, inshallah you will see in the next slide. Factor 10 comes, then you will see all the steps after factor 10, they are common pathway. So qabl factor 10, the 2 pathways are coming and they are coming on to which factor? Factor number 10, ashara. Second thing, after that, once factor 10 is activated, one factor number 10 and the 2 pathways are coming to factor number 10 and activate factor 10. Khalas. Okay. After that, the next phase is conversion of prothrombin into thrombin. Remember prothrombin, factor number 2. Remember that? It's molecule in your list. So it will be converted into thrombin. Okay. In the next step, thrombin, you will have the conversion of fibrinogen to fibrin. And after that, once the fibrin is formed, fibrin will form a clot. Alas, good. But this clot is not powerful. You have to make it strong, tight, okay? And you cannot easily break it. So you will do one more thing. You will use one factor, which is called the factor number 13. Remember, it's stabilizing factor, and now the clot will become a very, very stable, very, very confident clot. Okay? Alright? So, the 2 pathways are coming to factor number 10. Alas? Factor number 10 will activate prothrombin, and the prothrombin will be converted into thrombin. Thrombin will act on fibrinogen, and it will convert fibrinogen into fibrin. Tartib is coming like this. And now fibrin is formed, clot is formed. Okay, but fibrin has to be more strong. So now what do you see? You attach fibrin, 2 points, threads like this. Okay, threads will attach over each other, fibrin threads. And if you attach the threads, they will become powerful. Alright? And a powerful clot will be formed. So did you get the idea that we are doing it in 4 phases? Phase of 1, phase Tani, Talit, and 4. Okay, one by one very quickly. Okay. Phase 1. It means we are talking about the two pathways, separate pathways. One is Dafli and one is Hartley. Okay. So let's see what is extrinsic pathway and what is intrinsic pathway of coagulation, and what is the fuck between the two pathways. Difference you will see, inshallah. It's easy because different substances are used in them, and that's why. But what is the meaning of extrinsic and intrinsic? The first question is that why have you chosen the word extrinsic and why have you chosen the word intrinsic? I gave you the meaning of intrinsic, yani which is working only inside, intravascular. Okay? No extravascular connection. No wall is broken. No blood is leaking outside. No tahreek in the blood vessel. La, the blood vessel is closed. Only endothelium is damaged and okay, clotting will start. And that is intrinsic pathway which we will work. Okay? Intrinsic pathway. When there is a problem in the blood, when there is some damage in the blood cells, they will release some substances, clotting substances. Or when the endothelial cell, yani I told you the tile, I just take one tile from the blood vessel. Bas, few tiles I remove. I am not making a hole here, but I am removing the tile, endothelium only, fakat endothelium. And this process will start. Intrinsic pathway will begin. Okay? Intrinsic pathway will happen inside the body, inside the blood vessel. Yes or no? Again my question. Listen to my question. Intrinsic pathway, okay, will happen inside the body. Yes or no? Yes. Inside the blood vessel.
Yes.
In the tissues?
No.
No. Forget about it. Alright? Will this pathway need a tissue factor?
No.
Intrinsic pathway. Does it require a tissue factor?
No.
No. Why? It does not require tissue factor. Because tissue factor is module outside. Okay? When the blood vessel is damaged, it does not require the tissue factor. Okay? Now, I will give you an example. For example, I take an injection syringe. Okay? I put it in my vein here. And I draw some blood. This blood is directly coming into the syringe. Is it going into the tissues? No. I just take out that blood. Alright? And I put that blood safely into a test tube. I take one test tube from the lab and I put that blood. Okay? Leave it for 15-20 minutes. Khalas, leave it. That blood. What will happen to that blood? Intrinsic pathway or extrinsic pathway?
Extrinsic.
Tell me, think and answer. Yes, it's very simple. Look at the technique I used. Okay, I did not take the tissue factor into the blood. I directly went inside the vein and I safely cut the blood. I take the blood and shift that blood. So it means only the blood is coming directly into the test tube. Or I leave some blood on this ground anyway and leave it for 10 minutes or 15 minutes. What will happen? It will again start clotting, isn't it? So which pathway is activated in the test tube or here? It's only fakat intrinsic pathway. So now you tell me, intrinsic pathway is working in vivo. Vivo means inside the body, yes or no?
Yes.
It's also working in vitro, outside. Intrinsic pathway. Is it working in vitro or not? What?
Yes.
The needle.
What?
Yes.
Look. Look. You are using it now. Barra, blood is mojud outside. And the blood will clot or not?
Yes.
So which pathway is going on here? Outside the body. Intrinsic pathway. So now the question is, it is working inside the body in vivo, yes or no? Yes. It is also working in vitro, outside the body. Alright? Got the point? Clear? So intrinsic pathway is clear? Okay. It takes some time. It's a taweel pathway. Yani more time is needed for this pathway because there are many steps in this pathway. Okay? Alright. So this time is written that it starts in 1 to 2 minutes and it takes about 5, 6, 7 minutes for continuing itself. Okay? So it takes time. Look at this side, extrinsic pathway, or the Harji blood. Harji means now you are talking about the blood has come out of the damaged blood vessel. The blood vessel is broken, the wall is broken, and some blood has come outside, or some tissue juice, some tissue damage has gone into the blood. Now in this case, tissue factor is mojood or not mojood? Yes, vessel injury, vessel wall injury from outside and from the vessel wall, the tissue factor is mojood now. Okay? And this tissue factor will initiate the pathway, because this pathway is beginning from the tissue factor which is coming from barra, from outside. You will call this pathway as extrinsic pathway. You got the point? Why are you calling this pathway as extrinsic pathway? Because it happens, the starting point is mojood from outside. Yani it's extrinsic tissue factor which is coming. Okay? It's not starting from inside, it's starting from outside. So that's why you call it extrinsic. Are you clear till here? Yes. Everything is clear? Okay? Alright. So tissue factor is responsible for that. Now, this pathway will happen inside the body. If there is a wound, if my skin is cut and the bleeding is happening, will I have the extrinsic pathway here working or not?
Yes.
Yes. If you are playing Kurabul Kadam, as I give example, you fall down and your skin gel is okay. But after some time, so the blue color, blood is now there under the skin. Below the gel, the blood is mojood. Okay? It is mojood. Your skin is normal, but your blood is mojood below the skin. Is extrinsic pathway working there or not?
Yes.
Definitely working, because the blood vessels are broken and the blood has come out and the tissue factor is mojood. So tissue factor is working, right? So this will result in clot, but extrinsic pathway. Okay? Extrinsic pathway is working outside in the test tube? No. Is it working if the blood is over the wall or here or there if blood is mojood? No. So it is only working fakat in the vivo. It's not in vivo and vitro. It's only in inside the body in the natural situation. Did you get the difference between the extrinsic pathway and the intrinsic pathway? Everyone? No? Clear? Anything which you don't understand here? It's certain. So the two pathways will work and two pathways will finally come to one common point I told you. And that is factor number 10 activation. They will both activate factor number 10. Okay? After that, after factor Ashara, then the pathway, remaining 2 or 3 steps of the pathway, they are called common pathway. Because now they have merged and Wajid pathway will go. And that is called the common pathway. Okay? Alright. Look at that picture. It's a little bit complicated, but we, inshallah, will now understand it better. Because we know about the names of the clotting factors. We know about the number of the clotting factors also. Okay? So now we can do that, inshallah. We'll do that. So look at that diagram. This diagram, look at the board or look at your own tablet. Okay? And just try to follow. I am speaking and you are listening and you are looking at the diagram. All of you. Okay? Can you see the two pathways here in the picture? Starting point of the two pathways. Extrinsic is maktub and intrinsic is maktub. Can you see that?
Yes.
Okay? You see, it's Yameen, it's extrinsic pathway on your right side, and on your left side, it's the intrinsic pathway. Can you see that?
Yes.
Now, overall, when you see this pathway, okay, in the middle, there is a green color, Akhdar. Can you see that?
Yes.
Factor 10 and factor 7 maktub here. Before that, there are two pathways, separate pathways. One is coming from the extrinsic and one is coming from the intrinsic. Which one is a Tawil pathway? Intrinsic pathway or extrinsic pathway?
Intrinsic.
Definitely, intrinsic pathway has more steps. It's more complicated. Can you see that? Isn't it? So, let's talk about the extrinsic pathway first. Okay? Starting from the right side. Extrinsic pathway. Okay? Now you see. In the extrinsic pathway, the first thing which will happen is the tissue injury. Okay? The tissues are injured. When there is a tissue injury, from the tissues.
مش مكتوب.
Vector, خلاص. What is maktoob there? P